Now, the adverse effect of benzodiazepine. Benzodiazepine is relatively safe drug. It may cause adverse effect to elderly and the patient who have some systemic inefficiencies. The adverse effect is usually related with its effect, the systemic effect. We know the benzodiazepine act on the central nervous system and different parts of the central nervous system. So the adverse effect would be related with that parts. First of all, the benzodiazepine act on the limbic system, and our limbic system is related with our memory function. So if the benzodiazepine impair the memory function, that will produce the amnesia. Amnesia has different forms. One form of amnesia that if the event occurred today and I forget the event from today onward, that will be the anterograde. And if the event occurred today and I forget the event before this day, that is the retrograde. So the benzodiazepine causes the anterograde amnesia, and anterograde amnesia has some advantages. And if we do a painful experience or painful procedure to a patient and patient forgets the matter, that will give the advantage to the patient. Say for example, if we do the endoscopic procedure, that is a painful, or some operative procedure, if the patient forget the memory of that painful events, that will helpful to the patient. And the benzodiazepine can be used as a pre-anesthetic medication for the anesthesia, and it can be used before the endoscopic procedure and minor surgical procedure. We use this adverse effect in our clinical practice, and it acts on the medullary motor function. So if the motor function is impaired, the ability of driving a car, that will be impaired. The benzodiazepine causes the disturbance of these motor activities, and sometimes the benzodiazepine causes the night sleeping, night walking. That means sleepwalking. The patient may walk within the sleep. Patient may talk within the sleep. That is the sleep talking. And sometimes this benzodiazepine may cause the patient to talk more and more. That is the talkativeness. It is also the adverse effect of the benzodiazepine. And benzodiazepine acts on different areas of the brain, and it acts on the motor system. And another form of the disturbance in the motor system, that our balance system. We are in a balanced state due to our auditory part, vestibular part, due to our visual part, and our motor part. The combination of these three parts make us a stable or balanced human. When there is imbalance in between these three parts, there is some form of vertigo, some form of dizziness. So benzodiazepine may cause the dizziness or the vertigo, and it may act on the center from where the vomiting is controlled. So it may cause sometimes the nausea and vomiting. And the benzodiazepine has some other adverse effect related with the gastrointestinal system. That means diarrhea, abdominal pain. That might be the adverse effect.